So Deadly Heart Track is a mission, a trip to address rheumatic heart disease across the entire Northern Australia. Rheumatic heart disease is a disease that has been eliminated in majority parts of Australia, but unfortunately in Northern Australia, whether it's Northern Queensland, Northern Territory or Northern Western Australia, this disease is really rampant and continues to disable children and have major impact on communities and families. So this trip, the Deadly Heart Track, is really about uniting the country.
Last year, Bo and I had dinner and a very passionate conversation about rheumatic heart disease and about the idea of doing a trek to work with the communities in remote places to try to address this terrible disease.
Our highly qualified team is really here to diagnose and to pick up rheumatic heart disease early at the stage where it's treatable, to ensure that children don't need to have open heart surgery, to make sure that they have a long and fulfilling life. So we listen to communities, families, to see how we can work together to really put this disease in the history books.
Minyeri mob. Students that are required to be seen by the heart doctor while he's here.
My name's Jess Robinson. I'm the principal at Minyeri School. You know, our students statistically have a high rate of infection, and that rapidly increases their chances of developing rheumatic heart. Came across an email in my inbox one day and it had a flyer attached to it and a briefing about what the Deadly Heart Crew are all about. And then I realised that, you know, there's a real link here for us and an opportunity for us to jump on board. Yeah, I just couldn't wait for them to come out. I said, yes, we're in, when can you come out? I mean, it's so meaningful, the work that Deadly Heart Track are doing.
Unfortunately, the burden of rheumatic heart disease here in Gilk is unprecedented. It's one of the highest in the entire world.
So over the last couple of days, we have scanned around 200 children and we have found 10 children, 5% of the school-age population with previously undetected rheumatic heart disease. And that is just frightening. And that would be completely unacceptable in most communities in Australia. It would be an absolute outrage. It would be page one news. No one would accept it. And yet, we seem to accept that this continues to happen in Aboriginal people.
I don't think anyone could come up here and not take away from it that there's a huge gap in access to good healthcare, timely healthcare in these communities. I mean, some of the communities we've come into, there's a doctor maybe once a week, or, you know, if that. So some of the skin problems we see in the kids in the communities include scabies. So that's little sort of bites from mites, but particularly the hands and the feet, and they scratch them and then they become infected and then they develop skin sores. And the strep germ, the group A strep, and also other germs get into those sores, and that's the whole way that the rheumatic heart disease starts.
Our biggest problem is they need more houses. If you've got one person in a house that has a really bad infection of scabies, then that other 10 people are living in that house are going to get it. And I think that is the biggest health issue, is the overcrowding of housing. I know one house here in Gilbert alone has over 14 people living in it.
So there's so many barriers to diagnosing and treating rheumatic fever and rheumatic heart disease in remote Australia. The distances are vast. Children often have to travel for 2 or 3 days just to see a heart specialist doctor. And that puts a lot of stress on families. And a lot of children don't make it to see a specialist. So this is really critical when we see burden of disease this high, to make sure that we go to the people, ask them how they would like us to check on their children, and to work together in their own communities to get the diagnosis early and start the treatment immediately.
A lot of the care that's been provided, the rheumatic programs, the knowledge and the research into rheumatic fever and rheumatic heart disease have got better. But unfortunately, for all of that, this problem has not gone away, and in some ways it's worse than it was when I first saw this disease in the 1980s.
Fortunately, we have seen quite a few 4-year-olds who had open heart surgery just in the last 12 months.
So I think what this tells us is that we do not have health equity in this country. How do we address that? It starts with strong leadership, increased awareness. We want to be heard at all levels of government. I've been staring at this and working, in this area for nearly 40 years. I can't imagine anything that I want more to see before I depart than the elimination of this terrible disease. To lose kids and young people to this preventable disease is absolutely unacceptable. We should not accept it.
$1 million question, can we end it in Australia? I would love to say yes, and I'd love to be more confident than I am at the moment. We are moving in the right direction. The pendulum has shifted, and now we just need resources and funding to be able to put the strategies that we've worked so hard in Australia to come up with, the roadmap, the end game report, our guidelines at Rheumatic Heart Disease Australia. We need some resources and commitment, and then I'll be more optimistic.
For goodness sake, you only got one heart. Something happens to that, you've got nothing. And having these guys come out here and do the hard work that they've done, it's just amazing, and I hope to see more of it. It would be great.
It's phenomenal to see the engagement from the students, the community, the parents, learning about this.
Being involved in this Deadly Heart Trek has been really amazingly rewarding. There are some unbelievably dedicated people in each of the communities that we've gone to, and I've learned a lot from them, and I hope to be able to come back soon.
We are demonstrating that we can do this together. This can be achieved, this is doable. All we need is political will to fund projects like this and work on delivering what we know works.